Welcome to The Explainer. Today, we're going to dive into a highly distressing aesthetic mystery that a lot of people face, but honestly, almost completely misunderstand. Have you ever looked down at your hands and just wondered what on earth is happening to your nails? Well, today, we are cracking the code on a condition that completely transforms the structural integrity of your nails, and we're going to use the absolute latest dermatological science to explain exactly how to fix it.
Okay, let's jump right into this by asking a super simple question. Why would your fingernails, or even your toenails, suddenly lose all their natural shine and take on this coarse, chalky texture? It's pretty alarming, right? One day your nails are perfectly smooth and translucent, and the very next, they're opaque, brittle, and they feel exactly like a piece of fine grit sandpaper. It's a texture so rough, you might literally find it snagging on delicate fabrics.
Notice the completely dull matte surface on nails when this happens. They get covered in these dense, extremely fine up and down lines or longitudinal striations. There is absolutely zero gloss left, and the nail plate looks almost as if it's been dusted in a whitish-gray chalky powder. And like I said, it literally feels like fine sandpaper to the touch. Honestly, it's really no wonder people panic when they see this happening to their own hand.
Section 1. The big buffing mistake and what not to do.
So, when faced with this totally alarming texture, most people immediately make a very specific, well-intentioned but highly destructive mistake. They try to fix it mechanically. The widespread myth out there is that this is just surface dirt or maybe a severe fungal infection that just needs to be aggressively scrubbed or sanded away. But the scientific reality, which is backed up by clinical literature, is entirely different. This is absolutely not an external fungal invasion. It's actually an inflammatory reaction happening deep underneath your cuticle, right inside the nail matrix.
So what happens when you buy into that myth? Well, if you take a coarse sanding block to these ridges to try and just smooth them out, you are actively destroying the nail plate. You're stripping away the dorsal nail wall, which is your nail's main protective outer shield. This leaves your nails paper thin, incredibly vulnerable, and super prone to snapping and painful splitting. You're essentially trying to treat a deep biological issue with superficial physical destruction. And spoiler alert, that never works.
Moving on to Section 2, the science of Trachyonychia and uncovering the root cause.
To truly fix this problem, we really have to look under the microscope to see what's happening at a cellular level. Dermatologists call this condition Trachyonychia, which actually comes from the Greek word for rough. Historically, doctors called it 20-nail dystrophy, especially when it affects most or all of your fingers and toes. Clinically speaking, this whole situation is a direct result of immune cells, specifically lymphocytes, infiltrating the nail matrix. This sudden inflammation leads to intercellular edema, which is basically swelling between the cells, and it completely disrupts how your keratin cells mature. Now, what's really fascinating here is the clear breakdown between the two main variants of this condition. First, you have opaque trachyonychia, which is driven by severe, persistent inflammation. This is what gives you that rough, sandpaper-like appearance, along with hyperkeratotic cuticles, meaning your cuticles become really overgrown, thick, and scaly. Then on the flip side, you have the milder shiny variant. In this case, the inflammation is a bit more intermittent, so the nail actually keeps its natural luster, but it gets dotted with these tiny geometric pits that reflect light. It's the exact same underlying mechanism, just happening at different intensities.
To really visualize this, think of your nail matrix as a literal keratin factory located just underneath your cuticle. When hidden inflammation, those rogue immune cells we just talked about, infiltrates and disrupts this factory, normal production basically grinds to a halt. The newly emerging keratin cells are forced to stack in rough, completely uneven, and pitted rows. So that rough sandpaper texture you're feeling? It is quite literally the physical manifestation of cellular chaos happening right at the root. Section 3. Triggers and hidden links. Who gets it and why?
So who exactly is most susceptible to having their keratin factory disrupted? And is there a pattern we can look at? Well, while it certainly can happen to anyone at absolutely any age, the peak age of onset is primarily in kids, usually between the ages of 3 and 12 years old. It often starts out pretty insidiously, and because it's so common in this specific age group, parents frequently rush their kids into clinics worried about vitamin deficiencies or crazy fungal infections, totally unaware of the actual immune response at play. The absolute crucial point here is that this condition very rarely travels alone. It is heavily linked to other immune-mediated dermatological conditions. Now sure, it can be idiopathic, which just means it happens on its own without any clear cause, but it is frequently seen alongside conditions like alopecia areata, lichen planus, severe eczema, psoriasis, and even vitiligo. Interestingly enough, a published case study even found a rare association in a 5-year-old girl with selective IgA deficiency, which really hints at a deep connection to our mucosal immunity.
For instance, Trachyonychia has a really notable prevalence in patients with alopecia areata, affecting roughly 3.65% of that patient population. This brilliantly highlights how systemic immune responses can multitask, simultaneously affecting totally different parts of the body. The very same inflammatory cells that mistakenly attack the hair follicles, causing patchy hair loss, can also zero in on the nail matrices, resulting in that rough, ridged, sandpaper texture.
Section 4. Modern medical treatments and calming the matrix flame.
Because these kinds of nail dystrophies can cause pretty severe psychological distress and reduce self-esteem, especially in older kids and adults, it is absolutely vital to look at how modern medicine actually approaches calming this matrix inflammation. But before we get into the heavy medications, the single most reassuring fact for parents is that this condition is generally benign. In a lot of pediatric cases, especially the idiopathic ones, it actually just resolves completely on its own over a period of months to years. So sometimes, mere observation, reassurance, and active non-intervention are actually the best first steps recommended by dermatologists.
However, for cases that really do require intervention, recent clinical research offers some truly fascinating new options. A recent retrospective case series published in Frontiers highlighted incredible success using a drug called crisaborole. This is a novel, non-steroidal, small molecule drug that's originally used for eczema. Because of its tiny molecular weight, it easily penetrates the nail matrix to target the shared inflammatory pathways of both trachyonychia and atopic dermatitis. In this study, an absolutely staggering 82.1% of affected nails showed significant clinical improvement at just 6 weeks. That's a real game changer.
Now, in addition to crisaborole, which is a PDE4 inhibitor, dermatologists have a few other tools in their arsenal depending on the severity and the underlying cause. They might employ topical corticosteroids, though of course those carry risks with prolonged use on delicate skin. For more stubborn immune-mediated cases, there are emerging reports of using highly targeted topical therapies like tofacitinib, which is a JAK inhibitor. That's actually what was used so successfully in the case of the 5-year-old girl with the immune deficiency we mentioned just a minute ago. Section 5. Healing your nail matrix and establishing safe daily routines.
So what about your actual day-to-day routine? First and foremost, you need to completely shift away from aggressive mechanical reduction. Just ditch those harsh sanding blocks right now. Throw them out. Instead, focus entirely on hydration by massaging nutrient-rich biomimetic lipid serums, which are essentially ointments that mimic your skin's natural moisture, right into the cuticle fold. You help dampen that chalky texture, it restores the local skin barrier, and it provides the exact soothing environment necessary for your healthy keratin sheets to slowly rebuild from the base. And of course, if the inflammation persists, always consult a dermatologist to rule out those linked immune conditions we talked about.
I want to leave you with this final thought. Once you really understand the intricate science of the nail matrix, you realize the true nail care? It's an inside job. Your nails aren't just dead canvases waiting to be sanded down and painted over. They are dynamic, living extensions of your body's immune system. So the next time you notice a sudden physical change on the surface of your body, ask yourself, what exactly is your immune system trying to tell you from the inside? Thanks so much for joining me on this explainer, and keep learning.